of you you have one-sided papers in your practice, right? Correct? How many of you crush those papers, throw it? How many of you tear those papers, use it like a one-side thing to do your rough work? How many of you are very particular about reducing the pollution to the air, soil and water contaminants in your society? I have a lecture which is on just leaving positive footprints on the Mother Earth. So it's available on YouTube. I can share the link if you want. It's a 1-hour topic by itself, that one line. It basically means to say our contribution towards the environment in terms of conservation of air, soil, water and the basic energy is much less, wherein we are not adding to the burden of the Mother Earth. That is what carbon footprint means. And if I have to talk in terms of the detergent or the reagents what you use in your practice versus what you would like to reduce, we can have an individual chat, because as I told you, that itself is a topic to discuss, right? So we use, or I use, phosphate free materials. Now if I have to explain that in a very simple language, when you have bath with a soap, so when you wash the soap off your body, do you see a kind of a whitish thing on your bathroom? That means you are adding to the burden of Mother Earth, that's all. That is phosphate containing products, okay. Phosphate will suck water from the soil. What products I use does not do that, simple, okay. So that is what it is. So let's see what is the holistic dentistry workflow. So first we are having, of course, a questionnaire or something to ask the patient as they walk in. Then we are going to do some localized disciplinary dentistry, basic disciplinary documentation. How many of you maintain case sheets, have an informed consent? So all that, and you have to maintain these case sheets. I have been doing it from the first day of my practice till today. I have been continuously doing it. So there is no patients whose history is not available. All the photographs are available. Everything is documented from day one of my practice. So that is what it means. You do proper diagnosis and planning, case acceptance, scheduling and clinical script, clinical performance and the preventive recall. So you are having a kind of a rooster in your practice where you are working on that. Next is the orofacial interdisciplinary therapy, the hygiene, where you would start with first the perio consultation and then go ahead with whatever is the treatment plan for the patient itself. Then you go on to the treatment phases. The treatment phases could be preparatory, complementary or fully restorative depending on the case, of course. And last but not the least, you have the recall and the maintenance. So this is how you do a holistic way of doing. What are the remedial management? As I told you, it's a non-threatening environment. So you're going to have a lot of soothing effect. Staff become listening, kind and courteous. This starts with the way they pick up the phone. So when you pick up the phone, just from today, smile as you talk. The other person will feel you're very approachable. The moment you just pick and say enna, story goes there, right? So it is even just that smile. The other person from the phone is not even going to know that you've smiled, but he would be able to feel it. Gently explain what the patient will soon feel and for how long it would be there. Ask the patient for permission to continue. If you are doing 2-3 fillings, finish one and then ask the patient, are you comfortable? Can I go ahead with the next one or you want to stop here? So you always feel that the patient has a power. The moment the patient feels that, the patient will let loose. So it becomes very easy for you to work. You can also use the Baynes technique. I am sure most of you remember when you do something, you ask the patient to raise the left hand. The moment the patient raises the left hand, you stop the treatment because you understand patient wants to talk to you or tell you something. That is the Baynes treatment, Baynes protocol. Time for breaks and early morning appointments, especially for apprehensive patients. So keep them as early morning. Distraction could be through music therapy. Relaxation technique, I am going to do that just after this slide. It is again proposed by Milgrom, which controls your breathing and it gives a progressive muscle relaxation. I am just going to do that immediately after this slide. Sedation during surgical procedures and dental phobia treatment. You have the direct therapeutic exposure, introducing the patient to feared items in a slow gradual manner. Especially when you are talking about fear factor, that is how we do. So, I want all of you to again put down your pens. I would encourage you to remove your mask if you believe me. The reason is I want you to breathe in, breathe out. So, I know you can't breathe in your own carbon dioxide. So, just relax. I want all your handbags down.